everybody, and thank you so much for joining us. I'm delighted that you can be here today for the Being Young in the COVID-19 Pandemic webinar. And you can see my guests. I'll be introducing them just in a moment to share some of their thoughts on what I think is a really important topic, and I think something that we probably haven't discussed enough since the start of the pandemic. I think we've heard a lot about the impact of COVID-19 on older people, and I think that's quite right. We know that older people have particular health vulnerabilities and suffer from isolation, but I think that we maybe overlooked the impact of it on younger people. And in fact, Eurofound's Living and Working COVID-19 survey, which tracked experiences of 87,000 citizens in its April and July editions, finds that young people and women are still the biggest losers in the pandemic. So for the young, I think it's been a time of rising unemployment and falling well-being. They endured unprecedented levels of loneliness. They've lost out on the opportunity to travel. They've lost out on career opportunities. They can no longer emigrate. They can't even see their friends, and sometimes they can't see their families. Other times, of course, the young people have been forced to move back in with their families, which presents its own problems in terms of a decline in their independence and their ability to forge their lives and do what I was able to do in my late teens and early 20s, which was to get out in the world and make a space for myself. This week, we're entering lockdown here again in Ireland, so all of these issues, I think, are more important than ever. And I'm really proud to be part of this discussion because I think that we haven't talked enough about this. And unfortunately, I think when we hear about young people in the pandemic, it's frequently through the prism of criticism rather than empathy and understanding. Now, throughout the discussion this morning, you'll have the opportunity to put your questions through to the panelists, and I, thanks to the wonders of technology here, will be able to feed them through as we go through. And we'd like this to be an interactive discussion, so don't wait until the end. We will have some Q&A at the end, but please keep the questions coming. This is an opportunity, I think, for you to speak to some really wonderful people who I'm about to introduce. So we have Maria Walsh. Maria is an MEP and a Fine Gael member of the European Parliament for the Midlands Northwest since 2019. She is the Vice Chair of the LGBTI Rights Intergroup, which advocates for equality in the EU, and an important role in monitoring member states' legislative initiatives. And Maria has advocated throughout her career for the inclusion of younger people in politics. And in fact, I believe that's why she ran for office. We have Ian Power. Ian is the CEO of Community Creations, which is a not-for-profit company that's behind the really fantastic youth information website spunout.ie, and also 50808, which is a free 24/7 text service which provides everything from a calm voice, somebody to listen to, and immediate support for people who need it. Ian is also a board member of the Citizens Information Board and a board member of the Community Foundation for Ireland. And then we have Evelyn Inchier, who's an MEP from the Swedish Social Democrats. She focuses primarily on democracy, on human rights, and on the respect of the common values of the Union. And before her election to the European Parliament, she was the Secretary General for the International Union of Socialist Youth and a Deputy Secretary General for the Swedish Social Democrats. And I'm hoping that you'll be able to provide some context on different approaches to the lockdown and to the pandemic across Europe. And then finally, we have Massimiliano Mascherini, who is the head of unit for social policies at Eurofound, a role he's held since October 2019. He joined Eurofound 2009, so 11 years ago, to design and coordinate projects on youth employment, social inclusion, and the market participation of women. He led new research on monitoring convergence in the European Union. And Massi studied at the University of Florence, majoring in actuarial and statistical sciences, and he completed a PhD in applied statistics. So he's more than well qualified, I think, to talk about the research and what we know. I'm going to hand over to you now, Massi, for a few minutes to talk about what we know about the impact of COVID-19 on the young people of Europe.
Thanks a lot, Jennifer. And Yes, how is being young at the time of COVID-19, actually? This is the question that we try to address today, and in order to answer this question, we make use of the data of the survey on living, working, and COVID-19 that Eurofound carried out in April and in July, where a survey in which more than 80,000 participants took part of people living in Europe. So, in order to answer to the question, well, according to our data, being young in the COVID society means suffering less from the virus, but suffering much more from the economic and social impact of the measures that has been put in place in order to control the pandemic. In fact, we know that in terms of health, older people are much more exposed, dangerously exposed to the virus, and unfortunately, age is a driving factor of the lethality of the virus. On the other hand, actually, younger generation are disproportionately affected by the economic and social consequences of the precaution measures that involve lockdowns, especially in terms of employment participation, human capital accumulation, and social capital and mental well-being. And now we are going to review actually these three different areas actually. Well, in terms of employment, youth is more likely to work in sectors that has been hit very, very hard by the economic and social crisis. These include hospitality, leisure, but even retail, actually. Hence, they are more at risk of losing or having lost their job. And this is confirmed by our survey, where, for example, we saw that 11% of young workers have lost their job since the beginning of the pandemic, against the 8% of older workers. These data are confirmed by official statistics, and according to Eurostat, in Europe, youth unemployment rate increased from 14.9% to 17.6% from March to September, against an increase from 5.7% to 6.7% of older generations. Here, we can see, for example, that Sweden and Ireland follow different patterns in some sense, because according to our survey, Sweden is the country where the job losses has been the lowest in Europe, whereas Ireland follows the European Union average. Similar trend, although different, is then seen also by official statistics, where the increase in Ireland is higher, at least in the period of March to September, than the one observed in Sweden. If this is the impact on employment, it is important also to discuss the impact on human capital. You know that as a result of the restrictive measures in April, many countries closed their school, actually, and teaching went online suddenly in an untested and unprecedented way, actually, with major consequences on people and on students. We have to say that if in general population would like, workers would like to keep their working, their telework also after the crisis, online learning didn't have the same fortune, actually, and only 1/5 of the respondents would like to have more online learning after the crisis, actually, and only 1/3 actually of the respondents found the online learning as a satisfying experience, to say. But apart from the personal perception, actually, online learning has major consequences. The first one is that pre-pandemic scientific evidence shows a direct connection between school attendance and skill growth. So 12 weeks of online learning may actually leave a trace in the skill growth of young people. And this is a source of concern if we think of future school closures, because in this case there is a risk that the future workforce will have lower skills for a generation, actually, so it will be a tremendous impact. But also because there is the risk that online schooling foster inequalities. I mean, in online schooling, the support of families is essential. Families comes with a different amount of knowledge as well as opportunities and possibilities. Just think at the quality of internet connections. So these elements will affect the capacity of children and young people to learn, hence their skill growth. And so there is the risk that this will reinforce divisions between the privileged and those who are most in need with less amount of knowledge and opportunities from their families. Finally, social capital and mental health, actually. Restrictive measures have hit very hard young people and their social life in terms of cancellation of events, inability of meeting friends, as well as participating in community life and accumulating social capital. And the traces of these, especially in mental well-being, is visible from our data. Usually young people scored very high or higher, let's say higher than older people in terms of mental well-being, for example. We monitor the WHO mental well-being index in our survey, and we found that in April, during the lockdown, 55% of young people were at risk of depression against the 48% of the general population. In July, with the reopening of society, still the share of young people was higher than the share of older people at risk of depression, 48% against 41%. These trends can be seen actually in most of the well-being, mental well-being indicators, as for example, feeling of loneliness, tensions, resilience, but also life satisfaction, actually, that see young people scoring lower than older generations. This is new, as I said, in comparison to the pre-pandemic scenarios. And in terms of comparison, if we can see that, for example, reopening the society implied a big jump in life satisfaction in Ireland, for example, in Sweden, that a different approach was followed. The share did not change actually too much between April and July. So this is what we see from the data. We see that with young people suffered less from the virus and much more from the economic and social aspect in comparison to other generations. And I would say that I will stop here for the moment, and I leave also the other speakers to comment these days.
Thank you, Messi. That was extremely interesting and quite disturbing, I think. And if you've just joined us since the beginning, please do put your questions in through live chat, and I will feed them through to the panelists as we go through the next hour. So, Maria, I just want to get your reaction to what Messi spoke about there. He talked about youth unemployment, about the lasting impact of the move to remote learning, the widening of inequality, social isolation, depression, loneliness. It's a grim picture, isn't it, for young people?
Yeah, Messi presented, and good morning, good afternoon, everybody. Yeah, Messi definitely, the elements here just certainly presented a real thought-provoking chat, which I hope this will be. For me, looking at it and reviewing the report myself, why I welcomed the Irish government were among the highest rate across Europe at the start. You know, I'm conscious that dipped. I'm also conscious that one big thing for me, and something that me and my team are trying to work on and have been trying to work on since we got elected, was the fact that 31% of our young people, and that's 18 to 34-year-olds, proud to say I'm still in that age demographic, feel left out of society. And it's interesting, I don't think that statistic is relevant just to COVID. I think that statistic was relevant even before. And that's a worrying trend if that number increases. So we have a hell of a lot of work to do to listen, to incorporate, and to move forward. And the fact that democracy is wavering, and from a European MEP, while I wear the Irish flag, you know, I also work on legislation and policy that affects every person within the European Union. And I often think about that. It's not just an Irish hat I have to wear at all times, but I'm conscious that we've seen, because of COVID, particularly around minority rights, particularly around LGBTQI rights, particularly around member states not believing mental health is even a concern, that we see rollbacks of these rights within legislation from countries, particularly sitting on the east side of the European Union. And that worries me, not only as a young person, but as someone who's sitting in a big institution like the Parliament. But yeah, a lot of key takeaways, and really excited. I hope people send in some good questions, because probably one of my big things is at the finish of this is these conversations need to happen when COVID finishes, because we need to talk about proactive conversation and care, and not just have these statistics hit us in the face when we're in the midst of a pandemic or a financial crisis like we had in 2008. And because otherwise we end up like I did, and Jennifer, you mentioned it, you were able to run out of the house and leave the folks and then start life. But in 2008, many of us finished college, and I just don't want to see another lost generation because of COVID like we would have experienced in 2008 financial crash.
I think that's a really important point to remember, that this is not the first crisis that so many young people have had to live through in their formative years. Thank you so much for that, Maria. Welcome to Perspective on Ireland. And I'd love to get some perspective from you, Avian, on what you heard Massi say there and how Sweden is doing comparatively. You're doing better on some of the measures. Massi was pointing out that youth unemployment and unemployment generally has not been so badly affected. So how do you rate your own country's response with particular regard to the impact on young people?
Thank you very much for this very important event. And to be frank, I mean, the general figures and that the pandemic has hit young people, it's not surprising. And it's not surprising, of course, due to, if we look back to history, how other crises, not at least the financial crisis, have hit the youth employment. But it's also not surprising because we know, unfortunately, that youth policies that tackle challenges that the young people are faced with is not always prioritized among many politicians, both in the European Parliament, but also in the member states. So in that sense, I'm unfortunately not that surprised about the figures. And I also just want to emphasize before I go into the situation in Sweden, that I mean, the unemployment, when it comes, the unemployment goes also hand in hand with, or at least they're correlated, both on a short term, but also in a long term with the education policies. As said before, the COVID-19 hasn't hit Sweden in the same way, because not at least that we have had other measures. It doesn't mean that we haven't had any measures at all, because some people think that we have been acting like it is a normal situation. It's not at all the case. We have had more recommendation policies and some restrictions, new restrictions the other day just came up, for example, and there has been different measures in different regions already from the start. But we also saw that up to 90% of the Swedish population, for example, actually in the most cases, during not at least the spring break, followed the recommendations. One of the recommendations was to not travel between the regions during the break. And then we saw that was upheld by but when it comes to the unemployment, there is when I looked at the figures, it was the unemployment among the young people went up 4%, which is not that high in comparison, but nevertheless it shows that it also affected young people. And as been said before, also that young people is working in jobs that is quite vulnerable, not at least the tourism sector, for example. That has led to that those jobs are disappearing. Also, we have quite a lot of young people in jobs without time limits that they are being called in, and those kind of jobs also disappeared during the time of COVID-19. So yeah, it has hit young people a lot, even though the measures that we took didn't affect the young people and the population in general, but the young people in specific. And then when it comes to the education, I think that, one thing that our government have done is that we have increased the seats at the universities, for example, but also other kind of education seats. We have seen that now during the autumn, the applications to the different kind of education systems has been much higher than previous terms. And as a response to it, also the government has presented a package where we have increased the amount of seats. But one other point that was the schooling and the online education. I think that if we don't make sure to have good measures in place, since we don't know yet how long this pandemic will continue, that will also have a long-term effect, not only us who are still some kind of somehow young in a long term, but it will also have an effect on the even younger people on the earlier stage, or even younger people who are in school still, because of not, for example, having the possibility to get help from parents, for example, and so on and so on. So it will hit. It has already done it, but it will hit the people with vulnerable socioeconomic backgrounds, people of color, for example, since they are overrepresented in the people of belonging to vulnerable socioeconomic backgrounds and so on. So we need to address the current measures, the current challenges that we have, but also challenges that we might see in a long term as the situation for young people if this pandemic continues like this for a long time. One thing I just want to say before I stop is the youth guarantee. We have talked about it quite a lot in the European Union, and we have a youth guarantee. Unfortunately, it is not today mandatory, even though some countries would need it even more than other countries. But in Sweden, we do have a youth guarantee since many years back, and the youth guarantee on a European level, it's on 120 days, while our youth guarantee is it's kicking in after 90 days already. So I think the measures or the policies that have been conducted by social democratic governments, I would say, with ensuring that young people get help when they are unemployed, is helping the current situation to not escalate as it could have done, with with taking into account that we haven't had the same measures as the rest of the EU.
Okay, Aideen, thank you for that. I see questions are flying in here already from everywhere, and some about Sweden. So I'm going to come back to you in a moment, because I am aware that Aideen has another engagement, so can't stay with us for the entire webinar. So if you do have a question specifically about Sweden, or specifically for Aideen, or any of the points that she raised there, now is the time to send it. In the meantime, I want to go to you, Ian. What are you seeing? What are you hearing about how young people have been impacted here in Ireland and across Europe? And we tend to say, well, young people are very resilient. I know I've been guilty of writing that in some of my columns for the Irish Times myself. But is that enough? Is it enough to put the pressure back on the young people to be resilient and to get through this, to find their own resources to get through this? Or should we be doing more?
Thanks, Jennifer, and thanks everybody for having me this morning. I think our kind of tally, our research tallies with the Living, Working, and COVID-19 report that the Eurofound are launching, and look, young people's lives have been upended, and there's a certain amount of resilience that is going to come with this. But as has already been said this morning, this is, for some young people, the third crisis that they've had to live through. And I think their progression has been halted. Social connections have been severed. And as we know, not just in the Swedish experience, but in the Irish experience, youth unemployment is dramatically high at the moment. It's 37.5%. And I think Evan's point around the youth guarantee is a point well made in that, we learned a lot about what the possibility of youth guarantee is when we saw the Ballymun pilot here in Ireland, nearly half a decade ago, and really has the learning from that been implemented? It unfortunately, it hasn't. What we learned from that was that wrapping young people in support from their local youth service and youth workers helped to get them closer to the labour market. And we haven't resourced the youth work sector in a way that we can enable them to do that. Even before COVID hit, the youth unemployment rate was double the national average, which is normally the case. Normally that figure is stickier because of young people's transience through the labour market. But really, I think we have to double down on our efforts to try to ensure that young people are not left behind and that young people's progression is continued. We conducted a survey of 2,173 young people in conjunction and collaboration with the Department of Children and Youth Affairs here in Ireland, actually similarly around the same time as the second wave of fieldwork for this report in July. And what we found was that, COVID crisis had negative effects on young people's health and well-being, and especially amongst, as we've already identified today, socially excluded groups of young people. And the most common negative effects related to their mental health, including things like overthinking, concern, worry, anxiety, depression, and a sense of utter hopelessness. And more than a third of young people really reported that, missing that social connection with friends as being the biggest kind of issue that had caused them concern during the period. And, with what was positive again was that those young people who engage with youth groups and clubs and services were actually missing their friends slightly less. So we know that those types of interventions, when we can make them, have an impact and can be protective. Lots of young people had concerns about their education, particularly those aged 18 and over. And crucially for me in the study, 10% of young people said that they couldn't find anything positive to take from their experience of March, April, and May of this year. So it's not that other people didn't find things negative, but it was that, there was 1 in 10 young people just had nothing positive to say about March, April, and May. And particularly those who reported that were young travelers, so and also young people from rural areas, and you can understand why. And so I think really we have to reflect on that, and we have to think about how can we work to support those young people in a way that tries to make sure that they're not a cohort of young people that are left behind. And I think often society can be quite bad and quite ineffective at addressing inequality, but I think really it's not enough for us to throw our hands up in the air and admit defeat. We have to be redoubling our efforts to try to support young people who need it most. And what was interesting as well is just in terms of the focus on well-being in the Eurofound report, it was common for respondents to kind of experience a range of emotions. What was positive about that was that over a third of respondents, the most common emotion expressed was optimism, and young men in particular were found to be especially optimistic about the future. But anxiety was also a common feeling experienced by over a quarter of those responding, and many young people were particularly troubled by the uncertainty of the future. And I think it was interesting today, when we think about how we move forward, I see Mike Ryan from the WHO this morning, in the media talking about young people being sick of told what not to do, and how governments risk losing them in their messaging. And he was talking about how we need to have more of a positive message of self-empowerment, and that young people are advised on what they should do in more positive language, and we should be empowering young people to be their own risk managers, and we need to move towards telling people what they can do. And I think that's definitely something that young people reported to us as well, both through this research and also and anecdotally, that they need to hear, what is it can we do? How can we enable young people to socialize in a safe way? And also particularly, I think, Jennifer, you touched on this as well, the media narrative has been particularly unfair of, towards a generation who have done things that have been hugely unnatural for them to do, to kind of completely avoid their social networks for months on end. And yet then, when groups of people, slip up and make mistakes that are, used, quite widespread in the media to kind of denigrate a whole generation, when that's just not true. There's a huge the majority of young people who've been doing absolutely all that they can to their own detriment, both in terms of employment and also in terms of social connectedness. So I think we need to have that social acknowledgement as well from the state.
Thanks, Ian. I'm conscious that time is slipping on and we're going to lose Aileen shortly. So, and there are some questions about Sweden. So I'm going to bundle them both together. One is for Aileen and one is for Massey. The first question is, it's from Sarah. Sweden took a different path to other countries in terms of lockdowns. Do we see a difference in the mental health impacts for young people in Sweden versus other countries? And the second question is related to that. Sinead from Waterford wants to know, where the stats in Sweden show less of a change in the life satisfaction or risk of depression in young people, does the data identify what difference in approach or what support helps that? So I'm going to start with you, Aileen, on that, and then I'll come back to you, Massey, for your thoughts on that.
When it comes to the issue of how it has mentally or how it has affected the mental health of young people, if we look at the figures, we see that it has affected younger people in or higher. When it comes to the well-being, it has younger people less. But when it comes to the loneliness, we had Sweden is on the same level as, or the feeling of loneliness. It is that, Sweden is on the same level as the rest of the EU, basically. And when it comes to the loneliness, I would say that it is very much connected to that. It's in some way it's not in some way. It is very good that people have access, for example, to the housing market, which means that a lot of young people do not end up staying at their parents' house until they're 25, 30, but they have their own apartments, which means that during hard times, you end up being maybe locked down in your own apartment. In that sense, the feeling of maybe loneliness is higher than in some other countries where when you are locked down or you are locked in, you are that together with many other people. But nevertheless, when it comes to the well-being, it's still higher because there is a possibility, I would say, and the feeling that you can get out of your apartment if you would want to do that, and you could have a coffee with your friends if you would want to do that. While I know the feeling here in Brussels, where I am, it's totally other, because you are locked down in a house, and you're not able to socially interact more than via Zoom or via phone calls with the people outside your apartment.
Massey, does the research show anything about in the countries, particularly like Sweden, where the impact on young people's mental health has been less? Does the research help us to identify what makes a difference to that, and what are the measures that help protect the well-being and the mental health of young people, particularly?
Well, this is a big question, in the sense that we should not arrive to this conclusion only based on some descriptive statistics. Evaluating what has been the most effective way of try to get out from the crisis will require a more in-depth analysis that take on board the three souls of the crisis, that are the social, the economic, as well as the health component. So more data will be needed across time in order to indicate what was the most effective way of getting out from the crisis.
Okay, there's questions coming in here, a lot of questions, and really great questions. I see there's a couple about directed at Maria and at Aileen about what's being done at EU level. Will the EU Recovery Fund be part of a partial solution, and how can it help young people? And also, I think a really good question, how can Europe protect people with disabilities and, for example, those who don't have access to online learning? So, Maria, do you want to come in on those? What's being done at an EU level? Has the crisis even been recognised as an issue?
Yeah, absolutely. The crisis, I think, and hopefully my fellow colleague in the House here will also agree with me when I say, as an institution, as a democratic institution, we were very fast and reactionary in terms of COVID, releasing funds, approving. I think it was, as a new MEP, it was my first time in a space of time, and you hear whispers of historical hold-ups. I mean, we're currently going through CAP, and that's on the fence right now. But we instantly got behind, and everybody, all political houses, be it left or right, centre party, which is where the EPP group is, where I sit, just moved through legislation to get funding to member states. Now, our job then is also then to work with national parties across houses too, to make sure they're actually drawing down those funds so we can get them into the most needed. We see some slow uptake on Eastern countries, which is the case in protection, I believe, but that's only my view. In Ireland too, we also have some issues coming on and down the line with Brexit and a lot of young people on the border and periphery areas in terms of education. So I also want to claim that, because not only do we have COVID recovery fund, we'll also have a Brexit recovery fund when our neighbours, be it through a deal or a crash out in January. And all of that impacts not just the current generation that our age, but younger ones coming through in the university and access to education. I do want to just stress, yesterday we passed a resolution on education through COVID. Now, again, much like any own initiative reports, it had no funding or policy change, but it certainly was an intention from the Parliament to the Commission and Council to start working on and focusing on education, even though it is not a competency of the EU, which, like mental health, very frustrating, but collectively we just start chipping away at member states and the Commission actually looking at key focus points of that our member states or our citizens, more importantly, are calling for. I'm working on a file on vocational training, so that and I proposed an idea to the Parliament that we create a web portal, like a one-stop shop for younger people to access apprenticeships, traineeships, and vocational training. Sorry, put on time, so I'll ease up. Sorry.
Because I'm aware that we've kept Avian longer than she was able to stay, and I just want to go back to you briefly before you go. Or has Avian left us already? I think she's already had to leave. Sorry, Maria.
Sorry about that, Jennifer.
I just wanted to go to her for a last point before she had to go, but we've run over a little bit. So we were saying about the education piece.
Yeah. Apologies, it's a bad sign when a politician overtalks and kicks another politician offline. I apologize. But yeah, in that sense, and I can say, I'm sure she agreed with me that she's off air. But from a vocational education and traineeship point of view, I proposed a one-stop shop, essentially a place where across the EU, young people have access to any type of training or upskilling, and that you can be it locationless, which I'm loving the space for that now, or else physical move when COVID lifts. And that just gives a broad sense of solidarity across the EU, but it also gives access to Irish highly qualified, highly upskilled, gritty young people to get involved in the job market in a different way or in a different member state. And then just to reel it in a little bit closer to home in terms of human rights and the fundamental human rights, it is so key when we talk about funding and we don't see support for LGBTQI rights, that there needs to be a slap on the wrist or a reduction in funding for certain countries. And I point to Poland and Hungary for that, because we have so much greatness going on in very different member states. But I can't live in Ireland.
There's interruption coming in on the line somewhere. I'm not sure where that's coming from, but if you can still hear yourself, please keep going.
I can still hear myself. Can everybody else?
Yeah.
Okay, great. And I'll finish off on this point. I promise, Jennifer. I think while we talk about funding and while we talk about supports for member states and citizens, we also have to look at the fact that, and what I said in my earlier words, we have some countries that are rolling back on protecting citizens in their very fundamental human right, be it sexuality, colour, or creed. We've seen waves of support around the George Floyd resolution that came through the Parliament. We haven't seen enough uptake in the mental health space, which is extremely frustrating, because we talk about the best trade deals, we talk about currency, we talk about the power struggles. One one side of the house wants this, the other side of the house wants that. But yet, if we don't have citizens who can can leave their front doors, go to work, be it remote or in an office space, or a student feeling that they can learn because their mental health is in a struggle, then we are not doing our job as adults, regardless of whether we're politicians or stakeholders or whatnot. And I'll leave it there. And sorry for, I'm sure Evine is only delighted that I cut her off. Sorry about that.
Not at all. And you know what I feel? That the young people of Europe and the young people of Ireland are lucky to have somebody like you as a voice of Parliament advocating for them. So thank you for that, and thank you for all you're doing, because it is kind of alarming that in the midst of this crisis and in 2020 that mental health is not seen as more of a priority. And I just do want to say, I'm going to go over to Ian and Massey now for a comment, but if you're struggling, and I'm aware that we've talked about a lot of things that might be filling people's heads with anxious and distressing thoughts, there is support out there. There's support in every country in Europe. If you're in Ireland, you can text the word "spun out" to 50808, and you will have access to immediate 24/7 support. So there are support services out there. Then I wanted to go back to a question that arose here, and I can't see who asked the question. I thought it was a very good question, though. Sonia. Massey, do we know, are young women affected in different ways to young men?
Yes, according to our data, young women and in general women has been affected more than men by this crisis. These are for several reasons, actually. Firstly, because as young people, actually as youth, women also work in sectors that has been that are overrepresented in some of the sectors that have been hit the most by the crisis. But then also as young parents and the online, the closure of schools and the online learning has also added on women's shoulder additional care and family responsibilities that women also before the crisis unfortunately were taking. They had much more care and family responsibilities than men. The crisis has added additional responsibilities to them. So this create quite some problems in their work-life balance that during the lockdown and during the telework has basically become very hard and for them. And then if the situation continues in some member states, there will be actually then a trade-off between going to work or not, because sometimes it's not possible for some women is not compatible working and providing family and care responsibilities, especially if learning is online. So this is a thing that we should reflect more also this aspect, because the final risk is then that gains in terms of gender equalities of the last decades may vanish as a result of this crisis, and this is an important implication for our society as well.
Maria, I wanted to come back to you again, and perhaps Ian, you have thoughts on this as well. I know that LGBTQI issues are of a particular concern to you, as they should be to all of us. I wonder, has this been a particularly difficult time to be a young LGBTQI person through the pandemic, because of the isolation, because of the fact maybe they've lost their independence, they've had to move back in with their families? Is that something that you're aware of?
I should be a gentle woman here, Ian. Do you want to go first, or should I?
I don't mind. I think it was something that definitely we saw in the research here in Ireland, that young LGBTI plus people found, every aspect of life hard in greater numbers than their heterosexual counterparts. So if you're thinking about missing friends, particularly in terms of health effects, 28% said that their health had been affected versus 17% of their heterosexual counterparts. And particularly that loss of kind of social connection, for whom, young people who are coming to terms with their sexuality perhaps rely upon their community particularly to be able to kind of express themselves and to feel, well during kind of, times that are difficult. And so, where you may have been isolated with family members that may not know, that you are thinking about your sexuality and that you're coming to terms with your sexuality, that has been quite difficult. Maybe I think a lot of young LGBTI plus young people report to us as well, being in homes where maybe that's not something that's celebrated as it should be. And so, that has been something that we've definitely seen has been quite difficult. And they're also less likely to report optimism about the future, which is particularly sad as well. And really, we know that LGBTI plus young people are, disproportionately affected by societal and systemic discrimination, and therefore their mental health is affected in normal times. And I guess, what we've seen throughout this period is that that's been compounded, and a bad situation has been made worse for many young people.
And Maria,
and just add in. Yeah, and just to add into that, at the start of, I've been living as a gay woman for a number of years, and when I'm in Ireland, I'm currently in Brussels now, but when I'm in Ireland,
I think we have a little interruption to Maria's connection there, unfortunately, but hopefully we can get her back to continue that. Are you still there, Maria? I think maybe we might try and get Maria back again on the line. Here's a question, Massey, for you. Maria, we lost you briefly. I don't know. Too many people.
Sorry about that. I was getting personal. Probably they were trying to cut me off there. But just from my side, I when I'm at home, I live at home, and for me, I live in a very safe and welcoming environment. But and I meet young people all the time through school visits and LGBTQI community members in particular, because I sit on the intergroup that again represents all political houses, bar the far right of ID. But for me, I never realised the impact of COVID and an instant shutdown of countries when you look at people who moved away from home to try and protect their own sexuality would then be forced due to maybe rent changes or or employment changes and have to go home, and then ultimately have to go back in the closet. And that's just for LGBT or LGB. And then we have our transitioning citizens who in Ireland, we already had a backlog. COVID has just amplified that. I had a number of calls from constituents in the west of Ireland, young people who are either had started the process or who were about to start. And then all of a sudden communication from the medical offices just stopped. And when you talk about like the physical and the health element of it, and then you add in the impact of mental health, and then you add the element of a potential supportive or unsupportive family, and then the conversation around that, the education around that was horrendous to hear as a very welcomed LGBTQI woman in my own family. So we have a hell of a lot of work to do there. And I recently just working with our intergroup within Fine Gael, the rollback on HIV testing, the sexual health education, and we even look at mammograms, something that it should be easily accessible regardless of whether we have COVID, has certainly rolled back. So collectively, we, regardless of whether I sit in a party that's in government or not, I'm also a young person that sees holes in what should be easily accepted areas of society and support our citizens, regardless of whether you come from the west or the east or north or south. So we've a hell of a lot of work to do.
There's a question here from Quiva for you, Massey, about your research. Will you continue it? Are you planning more stages as the pandemic goes on?
Yes, we aim at continuing it and launching a third round of the survey in the month of December in order to capture this next phase of the pandemic, which we hoped months ago that was reflecting the new world after the pandemic and not the second wave of the pandemic. But we wanted to continue to capture and to monitor the impact of the COVID-19 crisis on living and working in Europe. So we are planning to do a third wave in December and then a fourth wave in spring 2021.
Okay.
So thanks for participating to the survey as well.
Yeah, I think we all hoped we'd be at the end of it by now, but Ian, you know, I think as the pandemic goes on and we're now, like I said, in the second lockdown here in Ireland, it's a constant question of trade-off. So this is kind of a difficult philosophical question, I know. I don't think anybody has the right answer, but you know, we have to protect the lives and the health of our older and more vulnerable populations. But there is, I think, a conflicting right that we don't really think about enough, which is the right of the, you know, of adults at the beginning of their lives to pursue a fulfilling, healthy, and productive, psychologically beneficial life. And how do you see that conversation happening? Do you think we're having it enough? Do you think that more needs to be done?
Yeah, I think the protection of schools and the protection of the opening of schools is a first step in acknowledging that children and young people were disproportionately affected back in March, not only for their learning development, but also their social development as well. So I think that's the first acknowledgement from the state that, okay, we need to protect at all costs that opportunity for children and young people. And that's really important. I think the other aspect of it is for younger adults. So we think about young people and their ability to, particularly if you think of going to college at this point in time, you've left behind, you know, your school network of friends, and you're meant to be at this moment in time developing a new network of social connections. And that's not really possible at the moment. And lots of, you know, clubs and societies that are running virtual events and all that sort of thing. But even if you think of those school leavers who are going into the world of work, who are trying to kind of maintain social connection, it's been quite difficult. And so I think what we'll need to see, particularly as the economy opens back up again, potentially in December, is a harm reduction approach to how can we have young people, you know, engaging and connecting with one another in small groups of young people. That's kind of a way to empower young people to socialize together. So is that groups of, you know, where you choose a group of 10 or 12 people and you stick to that group, and that's the group that you connect with over the next kind of 6 months or whatever it is. But we need to kind of, I think, evolve not just the messaging, but also the policy, because we can't, I don't think, go through kind of an 18-month period and expect people to be able to kind of, you know, at this moment in time in their lives, kind of restrict their social connectedness when it's such both a natural and crucial thing for them to be doing. And I think we need to, as older generations, acknowledge that is a truth, and that is something that we need to protect. You know, I think it's, you know, we would all in our 30s and 40s and 50s and beyond love to be able to stay connected, you know, face to face with our social networks. But I think we have to acknowledge that we have those networks, and we have had the time to develop those networks, and we need to give that space to younger people to be able to do that. And that is something that we have to acknowledge. It's not just about being, kind of saying that we all need to be able to socialize. Of course we do. We need that social connectedness. That's true of people of all ages. But I think if we don't allow young people to develop those social networks now, you know, we risk running, a situation where the impact of COVID is such a long lasting, and there's such a long tail to that. And we end up young people into their mid-20s still trying to find that social connectedness that they're meant to be able to foster at this early age. So we kind of have to get a bit real. And I think there is an acknowledgement in government that will need to be the case in December, not least so that everyone doesn't lose the run of themselves and we end up back in lockdown in January and February, but also as well to kind of think about this in a real way for young people and to help them in this moment as well.
I think sorry, Marie, go ahead.
Oh, no, sorry, Jennifer. I just wanted to add too, in terms of what Ian was just there. I mean, pre-COVID, we had this rise of connecting to social media and our devices. And then we also we had seen even down to the physical, the what we grew up in, like in eye contact, and being comfortable in having that, or just regular conversation. And then you have COVID, and then we still haven't fixed the problem that people feel the imposter syndrome or the disconnect through connection with social media. And I think just to add to Ian's points, like there's just so much more to fix. But we need to be proactive about it, because it just didn't start with COVID. It was going on long before it just got amplified with it.
Absolutely. And actually, Thomas just made that comment in the chat box here. He says, we can't forget that as well as the effects of COVID on young people, this comes on the back of years and years of cuts to youth services in both Ireland and in the UK. So we're coming to the end of our session, but I'm going to come to you all in a moment for your final thoughts and everything. But I suppose I would like to, first of all, ask you all, and this is a question for all three of you. You know, we're heading into second lockdowns here in Ireland. Other European countries will probably follow. What have we learned from the first lockdown, what we did wrong and what we did right, about how to protect young people as we go through it, and how to bring them with us? And there's a related question here from Christina, not just bringing young people with them. Christina's actually, or sorry, Karina, I should say, is from Turn to Me in Ireland. That's Turn number 2Me. And she wants to know how we can best support the mental health of young people in the immediate short term, even over the next 6 weeks until between now and Christmas. So a couple of things there. What have we learned? You know, what can we take with us into this lockdown? And as we take young people with us, what can we do to protect them and to support them? And I might start with you on that, Massey, and then just go around.
Well, it is. I mean, it is, as Ian said, it is the COVID pandemic has a long tail, actually, that should be considered when actions are taken. And I think that in these governments and the scientists probably should improve the way of communication, because improving the way in which some decisions are taken make them more easily to be accepted, and so there is less risk that people won't comply to them, make them then ineffective and useless. Because if people do not comply, then there is just are useless, and there is a damage then that without a value added. So this is quite important. And I think that also important to make feel young people that the economic and social cost of the crisis is shared among the various group, and adequate support is provided to young people, not just in this time of emergency, but as a way to build our new society after the COVID. It was mentioned housing before. This is extremely important when thinking of the world after the pandemic.
Massey, thank you. I'm just looking at the time. We've only 3 minutes left. So the question now, Ian, is going to be, what one thing do you think that we can do to better protect nothing else? At the same thing, Maria, and then we'll go around the table for a final thought. So if you can keep your answer to a minute, please. Ian.
I mean, very briefly, it's around kind of learning that the social kind of solidarity that we had back in March, April, and May carried us through a lot of the kind of initial period. And I think, you know, what's happened since then is there's been a breakdown in that solidarity, because young people have seen that actually when it comes to it, you know, is there the social contract there to protect them and to support them in the ways that they need. And I think if we're to be able to progress into next year in a way where young people stay with us and we bring them along, it's to start to recognize what are young people's needs, what do we need to be doing to support them, and putting that actual real support in place, and so that they see it and they feel it. And I think, look, there's been lots of things that have happened that are steps in that direction, not least, you know, the DCYA commissioning the research here in Ireland, which is really good as to what's going to keep, you know, what young people need. And then also the investment of an extra 5 million into youth work services in 2021 and different things like that. We need to see more of that. We need to particularly see those investments in, you know, schemes that are going to really support young people to get access to employment and other opportunities as well. So once young people start to see that happening on the ground, that's when hopefully we'll reconnect with that solidarity. So that's just my main takeaway.
Maria?
Yeah, from my side, picking up from Massey and Ian's point there, just communication and effective ones, that we're actually talking with people and not just to them. Another thing would be just in terms of the employment sector, what we can learn from. I'd love to see employers, be it multinationals or small homegrown ones across the country, or like the likes of Grow Remote, talk about what skill sets they need or they want to hire post-COVID, so that younger people actually have time to upskill, be it through online resources, so that they can hit the ground running when COVID lifts, and we can just get younger people right into the employment market. And then the other thing, and something that I feel we're really good at saying how not to get COVID, but younger numbers are, younger people being affected is rising. So we need to call that. While we need to reduce it, we also need to provide enough information, right? If you do become COVID positive, what do you need to do? Be it like, is it paracetamol and liquids and go to bed? Like, I think we really need to actually look at that conversation too, and not just create this stigma that if you do become COVID positive, that it's your fault, you didn't wash your hands and you didn't wear your mask enough, which is actually not the case at all. So a lot on education and communication.
I think that's such an important point. And on that note, just to say, because I know this from my own work, if you have a symptom, even if you think 99% it's not COVID, call your GP and get it checked out, because the only way that we can return to a normal life and stop this is if we get those numbers under control and stay home when we're not feeling well. Everybody, thank you so much. Massey is still with us. His camera has stopped working, but he's still listening.
Yes.
I want to say thank you to you all, and to the wonderful participants who joined us from all over Europe and sent in such intelligent, well thought out questions. The recording of the webinar will be available on the Eurofound and the European Parliament websites, and any questions that haven't been answered we will try to answer them afterwards if you want to send them in via the website. So thank you all to everybody.
Sorry, Jennifer. Yeah, sorry, Jennifer. May I say my last point, actually? Even
Please
though I'm not... very, very quickly. The things that I wanted to say is that, yes, I mean, regardless the strategy that member states are following, COVID-19 is the first and foremost an health crisis, and the need of save life is undisputable, but also to assess the economic and social implications on this. There is a hard task of balancing health and economic impact, actually, but concluding touching the Greek mythology, actually. This crisis can be seen as a modern Kerberos, the three-headed, hounded guard of the AIDS, actually, with the three faces, the health, the economic, and the social. And probably we should act as Heracles did in the Greek mythology, by killing all of them at once, actually. Not fighting one by one, because if you fight one by one, if you fight one, the other two will bite us. So we need to find a way as Heracles to take them for the throat and beat them all at once. With this, thanks a lot.
All right, thank you everybody. Massimiliano Mascarini, thank you so much. Ian Power of Spun Out. Ian, give us again the helpline numbers for people who might be feeling a bit down after our conversation.
Yeah, anytime. Text the word Spun Out to 50808 in Ireland, and there are equivalent services around Europe as well.
And to our wonderful MEPs, Avian, who had to leave earlier on, and Maria Walsh. Thank you all very much.
Thanks very much. Keep safe, everybody.